We realized several years ago that one of the biggest incoming group of refugees to the Sacramento area were coming from Iraq. So we had some pilot money from the Clinical and Translational Science Center available. And our partners at Opening Doors and the Mesopotamia Organization contacted UC Davis and said, let's write a proposal for this because we really want to know more about the health issues faced by recent immigrants when they come to the Sacramento area.
Opening Doors, among other things, works with newly arrived refugees. We resettle them here in the Sacramento area, and the largest growing population of refugees coming into the Sacramento area now are from Iraq, and we work with a number of them on a monthly basis. They come to the United States. There's a process that they've gone through. They've fled Iraq because their lives were in grave danger. They've fled to countries where they're unable to stay permanently. And they've registered with the United Nations Refugee Agency. And after getting that certification as refugees, they have been referred to the U.S. Embassy. So once they were assigned to the U.S. government, they went through a number of security checks, interviews, and those that passed that stage of the process then went through a medical exam and went through a cultural orientation training to begin to get them ready for the United States. And at that point, they were put on a plane. Meanwhile, here in Sacramento, our agency Opening Doors and our sister resettlement agencies have gotten a little bit of information about those refugees that will be coming to us here, and we've prepared for them by renting an apartment on their behalf, furnishing it, equipping it, and we then meet them at the airport. We transport them to their new home and work with them for the next 3 months, helping them to get oriented to life here in the U.S., to get their kids registered for school, to help the adults find jobs or learn English, and to attend to any medical issues they might have.
The stories of Iraqi refugees started in 2003 when the war started in Iraq. And as you know, the war is disaster everywhere. And the sectarian violence, military operations, destroyed country, all these things left thousands of families without any safe shelters. So they seeking another countries, neighbor countries from Iraq just to get a safe shelter for their kids and their families. But when they just arrive in the United States, maybe they get the safe. Yes, we are safe here with our kids. They got some education here, but there's a new challenges here present. New challenges like we cannot be on competition with the Americans themselves in this bad economy to get a jobs, and so we're gonna still waiting on the welfare systems that give us a medical. The medical to cover the health issues, it seems like it's not cover everything. As from our experience, there's no dental coverage, there's no vision coverage, or if you want to see a specialist, like you have to wait for 3 or 4 months. Imagine you have kids with a cancer and you have to wait 4 months to see a specialist. It's completely disaster for the people. As well as the primary care doctors, they don't know our culture, they don't know what's the 10 years of these war or impressions that we have. The mental health issue is very critical here, and we need support. We need the people first, the providers first, understand what's our mental needs, because there is no coverage for this side. There is no understanding what our mental needs. And from my opinion, 90% of Iraqi refugees or maybe other refugees, but I'm talking about Iraqi refugees here in the United States. They have mental health issue and they need mental care.
After we did the research, one of the things we found was, not surprisingly perhaps, that mental health and physical health are really linked. It's really hard to move on with life in the way that you need to when you're in a new country, when you're suffering from trauma, when you don't have a job, when you don't understand the language. And all of that impacts your energy, your physical health, and your mental health.
Refugees who come here have left so much behind, but they come with such determination and such eagerness to rebuild lives for themselves and their families. And they also come with great skills, and in the case of the Iraqis especially, many of them come with a great deal of formal education and professional experience. So they come with a great deal, but among the things they come with is what was caused from what they fled. So they come also with problems that often manifest themselves in terms of physical and mental health issues. And yet here they are facing a healthcare system that is so challenging at the same time as they're facing language issues and lack of understanding of the culture. So they need a little helping hand, but they don't need helping hands for a long time. They just need a little bit of a push for just a short period of time, and they take that and they go on to succeed. And my colleagues on the research team are just shining examples of that success. They met all kinds of obstacles, they overcame them, they persevered, and now they have jobs. And I'm so impressed by the ways that they're reaching out and helping other of their community members, both those families that are brand new to Sacramento and those that may have been here for a little while but are really finding it more challenging to adjust to life here. They give so much of their time and resources. So I'm just every day inspired by that population, and they are a huge gift to our community. And I believe that we just really owe it to them and to all refugees to address these issues of healthcare access.